My name is Graham Dufault. I am Senior Director of Public Policy at ACT the App Association, and I am pleased to moderate the next panel discussion between our three excellent panelists. Just one housekeeping item before we get started. I want everybody to think about where we are with the TV white spaces rulemaking. As Morgan and Commissioner Rosenworcel mentioned, the TV white spaces most recent item was a notice of proposed rulemaking that was adopted unanimously back in February. The initial comment period, the initial response period ended on May 4th, and the reply comments, where they're going to get into a little bit more of the details, are due upcoming, not too far from now, June 2nd. And so that's where we are with procedurally with this. And then after those reply comments come in, then the FCC will start considering all those and weighing the equities, and hopefully a final rule will then follow not too long after that. And so just wanted to make sure that was kind of on everybody's radar before we get going. And so want to go ahead and introduce our panelists. First, we have Elizabeth Henry, who is Legislative Assistant for Senator Sidney Hyde-Smith from Mississippi. Previously, Elizabeth was legislative aide for Senator Thad Cochran, also from Mississippi, and before that, an intern for the House Ways and Means Committee. She earned her bachelor's degree from Yale University and is now working on her law degree at Georgetown at night. And so when she's not doing that, and during her free time, she's established herself as one of the lead staffers in both chambers on telemedicine and digital health issues. And so we are lucky and pleased to have Elizabeth join us here today to share the perspective from Senator Hyde-Smith and from Congress on these issues. Next, we have Dr. Nicole Turner Lee, who is a senior fellow, and congratulations on the recent promotion to senior fellow at the Center for Technology Innovation at Brookings Institution. Previously, she was Chief Research and Policy Officer at Multicultural Media, Telecom and Internet Council, where she was responsible for developing and implementing the policy, research, and advocacy agenda over at that organization. She's been widely published and has published a number of really important pieces on broadband access with a focus on digital equity. And so some very recent publications that we'll be talking about today as well on telehealth, but also on local solutions to connectivity. So we're very pleased to have Dr. Turner Lee join us today. And then our final panelist is former FCC Commissioner and Acting Chairwoman Mignon Clyburn, who was Commissioner and Acting Chairwoman for 9 years at the Commission, and before that was for 11 years on the Public Service Commission in South Carolina, and so has been a leader at the highest levels in telecommunications and media policy, and established herself as a leader in issues from broadband access to minority media ownership, to low power FM, and to a number of different issues that are too long to list here, but suffice to say, we're also very fortunate to have Commissioner Clyburn here to join us. And so I would actually like to start with Commissioner Clyburn and draw on your experience as a commissioner, as acting chairwoman. You've seen a number of spectrum debates, especially play out. I think Commissioner Rosenworcel described the repack as spectrum musical chairs that can be used to describe a lot of different spectrum dockets. I think that you have very closely worked on from a leadership position, and I'm wondering how do those experiences sort of compare to where we are right now with strong bipartisan support for TV white spaces? Why do you think we're at a position right now where we're able to move forward with unanimous votes, and how have we come together like this?
Well, again, thank you for having me here for this very important discussion. I think if you were to look at, it's hard for me to not go back and look at history a bit, being the daughter of a librarian and a history teacher. And so I could say that the posturing and the positions that we saw back in the day, starting in the 90s, with the broadcasters moving forward with some of the more tense moments leading up to the National Broadband Plan with with NAB and the wireless associations, the various wireless associations. It is amazing in a relatively short period of time that we have come to a point of not total agreement, but the recalibration of the positions, because no one is arguing about the needs, especially now, of what this country needs and what the physical and geographic challenges are. If you're in a concentrated area, chances are high that you will get at least the infrastructure there. We'll talk about affordability and availability, real connectivity later. But in terms of the physical infrastructure, if you're in a concentrated area, economies of scale, yes. Sorry to say I majored in economics. Also, that's going to definitely be there. But with the majority of this nation, we have a big, huge, I don't know what the number of square miles, but it's crazy big, country. And a lot of it is not very dense when it comes to population. A lot of it where the people are clustered, or where some people who are doing necessary work, they're in, communities where, 1 or 2 or 10 people per square mile. So how do you connect those areas affordably? And this is why early on in my FCC career, I was looking at TV white spaces, before it was kind of cool, to talk about it, because I recognize that we're going to have to put rules and regulations and have partnerships in place to make sure that every more affordable type of infrastructure deploy is at our disposal. And so I'm glad to see the debate has just shifted a bit. No longer is anybody saying that broadband is not a necessity. That is off the table. And I think that held us back a bit. And I'll just be so bold as to say that. But now we're here and rowing in the same direction. So I will say the flexibility that's needed to provide these partnerships, I think that is what you're seeing coming out of the FCC. And of course, the realities that no one can do it alone, and that the most difficult places need to be connected. But we have to do it in a cost-efficient manner. And this discussion about TV white spaces is very important at this moment.
Well, and you alluded to the fact that not everything has been sort of resolved in all of the TV white spaces docket, and they're, like a lot of the dockets that you see at the FCC, they deal with the stuff that they're able to deal with readily, quickly. And of course, you kind of leave the really kind of tougher issues for later on down the road, so that you have more time to kind of sift through those issues. What's your sort of advice, I guess, to the commissioners when it comes to making sure you can get over that last speed bump, especially as we've got the COVID-19 pandemic that we're dealing with, and that's going to necessarily take a lot of resources? How do we make sure that we get over those kind of really difficult, sticky issues at the very end?
Come to terms with the fact that whatever is decided is not going to be perfect. Right. That the parties are going to point at 1, 2, or 3 things that are not necessarily to their advantage. But what we need to achieve here is that dexterity, or that flexibility needed to, while being mindful of harmful interference at certain baselines that we have to acknowledge. But the reality is, how do we give and enable more customer choice, more options? How do we encourage the equipment manufacturers to do what some of them promise to do? Right. And so if it's more certainty there from a regulatory standpoint, then let's give that to them so they will keep their promises. I'm not trying to make any more enemies. I've got quite a handful here. But the reality is there were some promises not kept. And so we need to take all of those things, and that would come from a regulatory certainty off the table. And honestly, we're just going to have to make some of the tough decisions that aren't going to please everybody, but they're very necessary to connect, particularly rural America, in the most cost efficient manner, in the quickest way possible.
Well, and one of the reasons we want to be able to connect folks in the quickest manner possible is, as we heard discussed on the first panel, the necessity of ensuring that people are connected for telehealth, for digital health, and Elizabeth,
Agribusiness?
and agribusiness especially, which is a great story about that from Nicole's paper on local solutions as well. But on telehealth especially, University of Mississippi Medical Center is one of our Connected Health Initiative steering committee members. We work with them very closely. They're a National Telehealth Excellence Center, and a leader in developing both live voice video telehealth solutions and sort of remote patient monitoring solutions for patients in Mississippi that have chronic conditions, and have some difficulty in going to actual appointments. But Elizabeth, wondering, what do you see as the opportunity here to make sure that very quickly and cost efficiently, as Commissioner Clyburn points out, we can make sure that those broadband connections enable those remote patient monitoring and telehealth services that we know are so effective?
Well, thanks, Graham. You're absolutely right. The University of Mississippi Medical Center has been a leader in this, in the most well covered would be their diabetes program, where they have taken diabetics in the Mississippi Delta, in an area where there are no endocrinologists in the entire Mississippi Delta, and been able to monitor them remotely so they don't have to travel to Memphis or Jackson to receive their care, and can learn to manage their care themselves where they live and where they work. Senator Hyde-Smith is a great example of the need for broadband access in rural America. Senator Hyde-Smith is from Brookhaven, Mississippi. She's a cattle farmer, and at her house in Brookhaven, she does not have reliable broadband connection, such that whereas many senators are able to Zoom with their constituents during this work from home time, the senator herself cannot do that. And I think that shows you the real need for broadband in rural Mississippi. A huge barrier to the University of Mississippi Medical Center being able to expand their work. And it really is a barrier to economic development in rural Mississippi, which is a big priority for Senator Hyde-Smith. A recent study by the Mississippi State University said that having reliable broadband across Mississippi would increase the annual economy by $750 million, with most of that in rural America. And I think that this pandemic has laid bare the inequity that has long existed with access to broadband in rural America. And it has shown the need for it in telemedicine, in education, as was discussed by the commissioners, and also in businesses being able to stay online during this.
So, and Commissioner Clyburn brought this up a minute ago with smart agriculture. There are a couple of different sort of specific use cases that are contemplated in the rulemaking and the proposed rules. The use of narrowband connections, so Internet of Things, and what I think of in that context is smart agriculture, where you have sensors in the soil telling you temperature, salinity, and things like that. But also geofenced moving platforms. So school buses are what are contemplated mostly there. So I'm wondering, what do you think the opportunities for those use cases are for Mississippians, especially rural Mississippians, and folks in rural areas across the country?
Look, I'll talk about three specifically. You talked about precision agriculture, which is the telemedicine of agriculture. And, Senator Hyde-Smith's on the Agriculture Committee, and she'll tell you agriculture today is very scientific. And for our farmers to be able to use those scientific techniques, they need access to broadband in the field, not just in town. So that's clearly a great example. Second, as you said, school buses. Students in Mississippi often have to travel long distances when they live in rural America on a school bus. Being able to do their homework while on the bus would be a huge improvement for these children. Well, as I said, telemedicine, there's a great need to expand pre-hospital telemedicine. In other words, telemedicine on an ambulance, or telemedicine at the point of care where the ambulance arrives if the patient is, prevent the need for Center for Medicare and Medicaid Services has recognized this need through a few pilots they're doing, but the real barrier to being able to have that telemedicine on an ambulance, telemedicine at the point of care where the ambulance goes to the patient, is broadband. That's the barrier. CMS is doing a lot to address the reimbursement barriers, and broadband is really what's keeping telemedicine from being able to go out on the front lines. I'll just add one last thing is, in Mississippi, when you're driving around, even on the interstates, even on the highways, there are places where you cannot keep a phone call going, much less have broadband connectivity. And so the ability to be able to improve broadband on our highways and roadways is important, not just for school buses, but also for ambulances.
Well, it's a great point, especially where you have ambulances that are going along the same kinds of routes. The highway that leads right to University of Mississippi, for example, probably sees a lot of ambulance traffic, and so
Exactly.
so you're thinking along the same lines, I think, as the folks that are working on the roles, and it's going to be, I think, potentially a very important use case for TV white spaces. And but it does make me wonder, Dr. Turner Lee, your recent publication From Rural Digital Divides to Local Solutions. It's the sort of locally driven needs and locally defined solutions that you're sort of highlighting there. And I'm wondering, what exactly is the importance of making sure, whether you're in Garrett County, Maryland, or you're in rural Mississippi, what's the importance of having that local aspect of the solution to connectivity?
Thank you, Graham, and I'm so honored to be on the panel with the Commissioner and Acting Chairwoman, as well as Elizabeth. I want to go back to what Commissioner Rosenwasser spoke about a little earlier in terms of the digital divide, right? I mean, it's an understatement when we actually have 50+ million kids that are out of school because they don't have broadband access in a very equitable manner. It's not necessarily that schools don't want to open, but they are being very morally responsible when they talk about equity. It's also shameful when we have jobs that are going online and we don't have the ability to ensure that, essential workers do not have the capability to work, from home or to do certain things that may not be open, like, apply for their vehicle registration, et cetera, if you don't have broadband. So we're sort of in this quagmire. And I think COVID-19 has sort of opened that up, where without access, and I think it was mentioned by Elizabeth, you are essentially trapped within an analog society. And what are we doing to solve that? I think Mignon Clyburn is right on with this, is that, we have to get at the root of why we have this problem. And I don't know if I would go as far as what Commissioner O'Reilly said in terms of, it's just not about a divide, but getting the access to the door. The bottom line is, without digital access, and I think it's going to be mentioned throughout this conversation, we are having people fall further behind because the new economy just does not have those same rules of the road going forward. So what does that mean for communities and TV white space? I wanted to share a quick story because I do have to age myself. I know I don't look over 15, but I do have to share this. So I was exposed to TV white spaces back in the early 2000s. A gentleman by the name of Harold Feld and a couple of people came to a place that I was working in Chicago and talked about this thing called TV white space that could bring broadband access to an inner city community. It was so interesting at that time. I think I closed the door on Harold and told him that would never work. Michael Calabrese and other guys who were actually working on this, because I didn't believe, at that time, and we were looking at things like, AOL, You Got Mail. It was very, very rudimentary, very, bottom level internet. You fast forward to today, I had this privilege, as you mentioned, to actually see a TV white space project 20 years later. And I was really intrigued by it because I'd heard about it coming back, and I decided to drive down to Garrett County, Maryland, to actually see how people were using it. To your question, what was so fascinating about it, and that's why I wrote the paper on it, and it's ultimately getting into a shameless plug, the book that I'm writing that's coming out in 2021, what I found was that there are people who are trying to figure this out by themselves. And we spent a lot of time, unfortunately, in Washington trying to come up with more wholesale solutions, whereas what I found in Garrett County was a 5-room school was using a TV white space solution provided by a small small to mid-sized telecom called Declaration Networks to wire this school. And as a result of wiring the school, that team was part of the state champions of the robotics club.
Wow.
A 5-room school leveraging TV white space. To Elizabeth's point, what I also met and encountered was a mechanic. Guy who owned the only auto mechanic shop in the town, because Garrett County, if you don't know, is wedged between Pennsylvania and West Virginia. It's got more cows than people because the square footage of the land outnumbers the physical bodies. But this mechanic told me, he said, we have a TV white space that comes through my shop. As a result of having this, I actually can wire up to my home, which is right above the shop, to my wife, who can now work out of Boston. And instead of going through 10 books to find a part, I can actually go right online and order a part, which years ago I could not do. Actually, weeks ago I couldn't do. He said, it's almost like an ice cream truck that comes into my neighborhood. You wanted some ice cream, but if they have the one with the sprinkles on top, you're going to buy that one versus the other one. He said not having it really was stifling their ability to do a lot of stuff. And so that actually raised, and I'll close here, raised eyebrows for me that we've spent so much time talking at these massive scale deployments that perhaps we need to go community by community and figure out what they need. And in this particular case, and I think it goes back to, and I'll speak later about telehealth, in this particular case, you have a community where social services couldn't be administered because people are driving 2 hours to give the service, 2 hours back to the office to type in the case notes, and then 2 hours back at some point to go actually see the family. And we're not realizing that these folks are becoming digitally invisible because they're sitting in areas, particularly in rural America, that without any type of solution, it's almost like being a student without a book. There's literally nothing that you can do right now in the society that will accelerate your quality of life, nor accelerate your access to resources. And that's particularly important right now as the lid's been taken off as a result of the coronavirus. So I would suggest, as we go forward in this conversation, people need to start thinking about not just the one big poster board, but the variety of posted notes that actually land when we're trying to talk about the national deployment of broadband. Since the broadband plan, it is shameful for us in the United States to not have actually already done this inventory in ways that allow us to leverage multiple types of technologies that actually help us reach some of the same goals. So I'll stay there, but that piece is available, but it just shook my heart to actually be out in this very rural community. I had a chance to go to Alabama, not Mississippi. So Elizabeth, I'll have to come visit you. And every time I go, I'm thinking, wow, there's ways for local curated ideas and partnerships and stakeholders to actually have a play, especially and particularly if the cost of facilities is way too expensive for any type of incumbent investment.
And that is why, Graham, this particular docket that's open at the FCC is so important, because it potentially could further enable that differentiation, those options in those communities, not just rural. I mean, we are fixated on rural. Look, Elizabeth's accent is more pronounced. It's here. I just pretend it's not.
And I'm from New York. I'm from New York.
But I am from South Carolina, and we grew up on a dirt. My grandparents grew up on a dirt road, which I can tell you did not have much by way of, we had the rotary dial, right? Until we didn't. I mean, way into my teens. So the point is, how can we allow communities and smaller, more nimble players or providers to personalize service, to do so more affordably and effectively. How can we do that? And again, this particular docket, I know it's not that sexy sometimes to follow FCC docket. As a matter of fact, it is way not sexy and exciting most of the time. But what it will enable us to do is to get to be a more attractive and to focus in on the challenges and needs of those communities, again in a quicker manner, but recognizing it's not a one-size-fits-all manner. I did have an opportunity when the program was nascent in Mississippi to go to Sunflower County and see this in real time and meet that grandmother everybody keeps talking about, who was almost the cheerleader. The most mature person in the study was a cheerleader for others to be compliant and to adopt broadband. It was because of her needs, not wanting to go to the hospital, not wanting to wait until she got into a crisis, that enabled all of this. So everyone has a different crisis, whether it's education, health, different levels of business, that mechanic, that small farmer who is trying to make ends meet. I don't want to overtalk it, but what can we do from an FCC, since I'm still fresh out of government, less than 2 years out? What can we do to further enable and to fuel, or to put the seeds in the ground and to fertilize it, by the way, to enable all of this? And that's why dockets like these are so important. It's not going to be easy. Everybody's going to come from their points of comfort and their positions. It's very clear if you read the comments where everybody is. But we've got to recognize, how we move beyond that And if we can start at the 50-yard line with our respective points of views, I really think we could move things forward in a more expedited manner.
And, you know, there's currently a research project going on in Mississippi between a mid-sized telecom, as Commissioner Clyburn brought up, Ceasefire, which is a Mississippi company, and Microsoft and other big companies trying to see how these solutions like TV white spaces, like several others, could be tailored to different communities' needs in Mississippi. And it's really showing that the need is there, that the desire is there, that the solution will be determined on a community level, as discussed. And I think that the need to expand this nationwide, the need to make this continue is only highlighted by the pandemic. You know, there were so many other ways to get around, as Commissioner Rosenworcel spoke of. You could go to state panel to do your homework. You could go to a local library. Those don't exist anymore. And additionally, there were barriers outside of broadband holding back telemedicine. Those, you know, some of the HIPAA concerns there, some of the enforcement concerns there have fallen away to the necessity of responding to the pandemic. And there's a lot of momentum in Congress to keep some of those barriers down even after this pandemic. So broadband really will be the last frontier. Sure, that everyone in America can access connected health technologies.
Hey, Graham, can I just jump into real quick? I think part of it is really looking at the TV white space technical solution as an additive, right? We're coming out, I think, in telecom policy, a lot of contentious debates around, you know, network ownership and network investment. And I think we're sort of at this point in our quilt of the fabric of broadband access, where we can actually identify those areas that probably need more yarn, right? Or need to be spun a little bit tighter. And I think that's where you start to see these types of solutions really contribute to some of those broadband deserts, particularly, and I want to go back to something earlier about the agriculture, where you're looking at these narrowband networks or you're looking at these small mesh networks that may actually be right on the farm versus, you know, the connectivity of the community. I ran into a guy in Lincoln, Nebraska, for example, that was a small telecom provider that was actually just wiring cattle farms. Now, I'm a city girl, not like these two young ladies here, and I was a little like, I wanted to go see it, but he told me it was a 6-hour ride after I got into Lincoln, and I said, I don't know about that, right? Cattle farm, you know, I got that close to a cow or cattle, but what I found to be so interesting, he said, as a result of wiring that cattle farm and using a very localized technical solution, he was able to actually improve the quality of life of the workers on the farm, in addition to doing some R&D or making determinants on whether or not feeding time should be now or later, or manure testing. I think that is such an interesting way to look at broadband deployment than we've ever looked at it before, right? We've really been focused on the geographic considerations and the challenges when it comes to investment. But I think these use cases also, I think, drive the need for more varied solutions. But the challenge is, and I think my colleagues know here, is I don't think we also have funding mechanisms that allow for that type of investment. And so we should really rethink, what does that look like going forward if we actually want to bring in more small and medium-sized people? Because right now, right, Commissioner, people have to go to RUS, you know, for some part of the funding, and then part of it to the FCC.
It's a patchwork.
Yeah, and maybe we should try to move past that patchwork to do something that's much more coordinated, and Congress could actually work, you know, to continue to do the large appropriations, right, when it comes to broadband deployment, but then also find ways to fund these smaller projects that could actually be much more replicable and scalable within the confines of that geography.
Well, one of the fundamental pieces of that is making sure that we understand exactly where people are who are unserved, who are underserved, who are don't have access to a single provider, or might have access to not too many options that really provide broadband. And so, you know, getting mapping right is going to be a challenge, and it's been a challenge that the FCC has been working on. Congress passed the Broadband Data Act. Just wondering, you know, I know that they have asked for appropriators for additional funds to carry that out. You know, what's it going to take, I think, to make sure that they're carrying out what Congress set forth in broadband mapping?
It's got, you already said it, dedicated funding for that. But I want to point out that states like South Carolina, they've released their own data. You know, states got, I'll try to be politically correct. States got darn tired of waiting for accurate numbers. And they took it on themselves to really do their own granular work. And I'm proud of my state for putting forth. They were fueled and supported primarily from the Palmetto, sort of a telehealth perspective. That was a primary motivation. But the beneficiaries are all of us, that rely or better enabled by being connected. Now, one of the things that I want to point out, because I know we're going to run out of time in a few, and Graham, Nicole could definitely tell you, I could co-op a session, so forgive me. But, when Nicole, I think, mentioned, the economic side of the coin, I have taken issue for a number of years. I don't think the equation is as complete. Because I think what Congress and the rest of us have a tendency to do is just look at what the upfront cost is, what we write a check for in real time. What we also need to look at is what the benefits are, derived, and what the avoided costs. And this is when, my little economic hat comes on. I've been talking about this for a minute. What are the avoided costs? What are we not paying by the Mississippi study has just incredible data that shows you 10,000 road miles with the initial inaugural study, $333,000 of state money saved, in the state and the Medicaid. I always get Medicaid program. All of and that one patient who went to the hospital 6 times in 1 year did not go at all. Just think about what the avoided costs are, and we can make the economic argument all day long. We don't do a great job of expanding that equation and making it more relevant to ask ourselves, is this investment worth it? And 90+% of the time, the investment is worth it if you look at the equation is appropriate and comprehensive enough.
You pointed out, Commissioner Clyburn, the main problem that we have in enacting the changes that we need to see, especially in Medicare and other federal laws, to make sure that there is access to telehealth. Dr. Turner Lee, your recent report is comprehensive. It looks at all the different types of barriers that there are right now in the law to the deployment of telehealth and remote patient monitoring and digital health. There's a lot of them, and so there's a lot to cover. But wonder if you could share a little bit about that, and how could TV white spaces and other kind of cost-effective measures to deploy broadband help lower those barriers or remove at least one of the main ones?
Yeah, I mean, I think, and again, we just actually, shameless plug, we just put out a paper on this telehealth before and after COVID-19. And so, it's so funny. I have to tell people as a researcher, this was just my period of time to actually have all these reports out. We wrote this report over a year ago, almost a year ago. And then we had to update it because of the national pilot that's going on right now with telehealth. So that paper sort of speaks to what Commissioner Clyburn is talking about. It also speaks to, I think, the whole purpose of this conversation, which is innovation keeps pushing forward. And we've seen innovation actually happen on the TV white space side, where we're now seeing these this ability to wire rural areas and potentially urban areas that don't have a lot of choice, or have these dead spots, whatever the case may be. And we're seeing innovation on the healthcare side. And in both of these cases, on healthcare as well as some of these network deployment strategies, they're saving money and they're making these services much more affordable. So in the paper that I put out in partnership with the John Locke Foundation, our argument was really around the age-old, decade-old conversations on, the federal barriers to telehealth administration, from licensure to insurance, interstate insurance, medical practice care, et cetera, to, what do we do now that we actually have digital health and, health wearables, et cetera? How do you actually manage all of this innovation under an old, outdated regulatory framework? And what we've done in the legislative side of it is we keep putting square pegs in round holes. So we keep sort of restricting the use of telehealth, for example, primarily because we want to answer this slew of questions that under this new type of technology we can't answer, right? And we want to put the reimbursement or the parity at the same rate of an in-office visit, when we should be incentivizing doctors to do more of these. particularly because they reduce the cost of, investment, whether it's having the nurse, having the office space, et cetera. You can give more. And that's particularly important, I think, for Mississippi and South Carolina. We have high rate, and Chicago, we have high rates of health disparities, where people are actually walking around with smartphones and the ability to get online and have a real-time connect with their doctor in ways that we could never done before. Or with artificial intelligence, you could actually have something that monitors your blood sugar that actually gets transmitted to your doctor and helps with any type of prediction to ensure you're not going to go into any type of cardiac arrest or otherwise. So I think going forward, what COVID-19 has done is it sort of unpeeled the apple, and it said all these decades longs of regulatory regimes that have not been very much complementary of innovation, we need to reevaluate and we need to revisit. So we need to look at the data that comes out of telehealth and COVID-19 and say how much was saved from poorer people using the emergency room as a primary care doctor.
Right.
To what extent have we created better well-being simply because we actually allow people to social distance via medicine without having to be infected or reinfected? Those kind of questions, Graham, I think are really pertinent to sort of pushing legislators to sort of get beyond what felt good because we've always done it that way to something that actually can move the needle so much further in terms of innovation. I'm not again going to date myself, but in 2009, Elizabeth, Congressman G.K. Butterfield, who was one of the first people to do an event for me, telemedicine was one of my first topics. And it's always been an intriguing, I think, advancement in healthcare because it just gets away from, I think, some of the health outcomes that we often cannot control by, sort of upping. As somebody said the other day on a panel that we had, it increases the quality of care while reducing the cost. And so I think, again, going forward, we need to look at these innovations in ways where we're actually bringing back value. I think, Commissioner, that's what you said, to communities versus really stopping that and restricting the potential of new technology because the train has already left the station, right? So we've got to figure out ways to embrace it so it's much more beneficial for populations.
One word that's been used a lot in the last few weeks is flatten. What to me, all of this potentially, what this will do is flatten a lot of those curves or those barriers to access. Let's face it, whether you're in Chicago or in Starkville, Elizabeth, my niece, graduated last year from Stark Vegas, I call it Stark Vegas University, Mississippi State. When you talk about it, how many doctors per square mile? How many clinicians can you get to in terms of, obstetric care, what's open where? And so when we talk about this, some of the most vulnerable, higher presenting, most in need individuals could be, benefited by being by having a smarter home or a smarter device and the like. And we save money with that investment, not losing it. So what I'm hoping is that this incredibly tragic pandemic will force us to look at everything service delivery wise in a manner in which 21st century needs are truly taken into account. Now, I want to maintain a great relationship with my medical clinician, but I think the whole fee for service, getting into something that we shouldn't, the whole regime needs fixing.
Right.
Your incentive is to fix me when I'm sick, not to keep me well. And until we look at that when it comes to healthcare delivery, and until we look at that same template or paradigm when it comes to broadband connectivity, until we look at it that way, we're going to have the same type of, debate, and we're not going to get the optimal returns that we need. So I think the time is now to really have hard discussions, look at ourselves in the mirror and say, it's time for a bet, as Mayor Bowser would say, a better normal, not a lowercase new normal.
And I'll just add one last thing, saying that quantifying all of this is so important. I think that's been a theme that drives Congress, being able to say, these are the cost savings, these are the potential economic development benefits, these are the ways that would save Medicare and Medicaid money are so important. At the last hearing she went to in March, Senator Hyde-Smith was really pushing the Congressional Budget Office on this. And I do think one of the great things about stealing the apple, as but is that we're currently in an experiment to generate all of that data and monitoring that data and producing reports and updating your report after this to show cost savings that were achieved is more critical than ever to build the case long term for solutions like TV white spaces and additional solutions that come available in the future for rural broadband.
Yes.
So Elizabeth, do you think now is the time that we're going to be able to make those advances on a permanent basis to the Medicare system to make sure that telehealth is a reality, and that maybe value-based care, as Commissioner Clyburn alluded to, can be a reality going forward?
As Graham knows, I've been working on these issues for a long time. You know, for a long time, Medicare was spending like $14 million on telehealth, which in the Medicare program is a rounding error, right? We have seen such explosion over the past few months. I don't think you can put that genie back in the bottle. I think the American people will want to see this, and I think you're seeing there was a long time problem with provider uptake of telemedicine. I think you're seeing providers forced into uptaking and realizing they like it.
Right.
I think you're seeing again the increased number of technologies that are being allowed to be used for this. You know, you could have a Teams chat with your doctor now, which was impossible 2 months ago due to federal regulations. So I think that the American people will want this. Senator Hyde-Smith has been pushing for this long before the pandemic to allow telemedicine to be accessible. And, you know, broadband is a key aspect of that. Reimbursement is a key aspect of that. And I certainly, you know, many members of Congress have said priority is looking at these regulatory barriers that have fallen. It should be a high barrier for them to come back. If they've proven successful, we should make it the assumption that we will keep these barriers pulled back, and it should be a high burden for them to be reimposed. I certainly, that's Senator Hyde-Smith's hope. I think there are many members of Congress expressing that right now. I think the administration is expressing that, and I certainly think that there's a high chance that this provides momentum that's needed to create those advancements that have been wanted for so many years.
Yeah, and if I could add into that, I think Elizabeth is right on point. I mean, we need to really look at what we've actually learned in this implementation and keep what worked, right? I mean, I think the fact that we were able to relax the regulations within a stroke of a pen in the last 2 to 3 weeks against, you know, what actually under COVID were these artificial ceilings, right? Because the volume of in-person care had to automatically and drastically decrease. And now we actually see that not only are people using it for, you know, marginal services or secondary care services like dermatology, but primary care services. So it can be inserted in ways I think that is worth a reevaluation by Congress. And I would put in there, and we do mention this in the paper, you know, the challenge that we'll have is the reimbursement, as Elizabeth said, because right now we've been employing the parity laws when it comes to giving payment for services, which for some of your viewers, you know, essentially saying that what you would cost to be in the office should be the same as what you're doing it virtually. Some cases, you know, yes, it works right now, but I would actually just urge us to continue to think about that reimbursement trail, because the bottom line is if we come out of COVID, we sort of assume that that's the norm. We may disincentivize some providers to actually, you know, want to continue this because it's just easier just to have people come in, right? And we don't want providers sort of chasing where the dollar is, you know, based on their volume. In all honesty, this could actually help if it was actually lower and doctors had the right to choose this type of amounts that they wanted to actually assess. But I want to go back to the conversation about TV white space real quick. This is why TV white space is important, particularly telehealth, because it can support a variety of modalities. Telemedicine used to just be supported on Skype. Now we're using our phones. Now we may be using our tablets. Now we may be using our watch, right? There's just different modalities that we're actually engaging. Sometimes we're using email. Sometimes we're using our phone. And so I think that's also something for consideration. We talk about where is the network for these devices? And if you're in a space, and I think this goes back to Commissioner's point about being in urban America, where you just don't have the type of bandwidth to use this, strengthening an unlicensed hotspot, strengthening an ambulance, strengthening a bus. I'm a sole proponent of strengthening buses with Wi-Fi. They all actually serve, I think, as a place to actually deploy TV white space for a technical solution. So I think, Nan, I love the way you did this. I was kind of curious how you're going to tie it all together. But it's actually like chicken plus the egg, right? Not the chicken or the egg, because you need both to actually do it well.
So with the couple of minutes that we have left, just one last question for the panel. I think Morgan asked this of Commissioner O'Reilly as well, but I want everybody's thoughts here who wants to chime in. How do we make sure that the TV white spaces rulemaking remains a priority? As we know, month in and month out, when the FCC has their monthly meeting and they have a list of things that they're able to get to, making sure that sometimes long lost dockets can find their way not in the spotlight anymore. How do we make sure that it remains in the spotlight and that it remains a priority, because it's so important? It's such an important piece of the connectivity puzzle.
Underscore the economic efficiencies that can be delivered by Dish. Underscoring that with Dish, we can serve longer distances with lower frequencies. Again, with very technologies. That the dexterity. That will bring, the more competitive forces, the small business nature, the more comfort and differentiation that a potential consumer or of the internet service provider will have. There are very few dockets that can check as many boxes as this one. This is why, it's just so important. So I would say, what are the deliverables? And when you start enumerating and layering that with what our needs are in real time now, what's the quickest way for us to get there with the economic efficiencies and making the business case, which is another one of my refrains that Nicole gets tired of me hearing, going back to what Elizabeth. How do we make the business case? And if you're looking at going through an OMB lens, this should rise to the top. This should be one of the after the protocols you already mentioned. That I think reply statements are due next month. After the standard, this should be expedited, and the case is already proven. COVID underscored the need for this being expedited.
Perfect. The economic argument. We will continue to make it. We will continue to be noisy about this issue. This is where I would say to the audience, please join me in thanking the panelists, but I think everybody's on mute. So, the thank you will just have to suffice, and it's not going to be enough, but I really, really appreciate Elizabeth, Commissioner Clyburn, Dr. Turner Lee, all of your time and sharing your expertise. This has been an excellent discussion. And if there are no closing thoughts, we will adjourn and let folks go back to Zoom conferences and other things and Teams conferences.
And help them with homework that they know nothing about.
Exactly.
The new
That's why we need broadband. I mean, look at what we're doing here. Like, wow, like different states and connectivity. So,
yeah.
It's
all right.
amazing.
Well,
it's amazing if you have it.
That's right. That's right. That's what we're trying to make sure people have. And so thank you all. And don't forget to check out the website. Check out Dr. Turner Lee's papers. We're actonline.org. And we have a bunch of materials on TV white spaces and some background materials as well. So hope to see you there. All right.